I am 3 weeks out from my bladder resection surgery. I had a bladder resection due to a diverticula that was growing on the side of my bladder that caused cancer growth. The cancerous area has been removed now from my body. It was an invasive procedure, and so at the 3 week mark now I'm just giving an update on my recovery. The first 2 weeks recovery was very slow. I described actually the first week that I was catheterized. That was allowing for my bladder to heal, and I had a procedure to check the bladder. It was a CT scan where they injected me with a dye. They wanted to see if the dye escaped the bladder, because if it did, then that meant that my bladder was not healed up. That I passed that test, so I was able to have the catheter removed. Such a relief to have the catheter removed. So then it was on to the recovery of the wound. And the wound I have is a 4.5-inch incision that basically runs from my belly button south. And it's kind of similar to having a C-section. So really I have to get all of my muscles to learn how to operate again. But I'm also trying to keep that wound closed. On restrictions, nothing can be lifted more than 5 pounds, and no stairs, and just be really slow and deliberate with my movements. I started to feel really good in the 3rd week at home, and so I started to kind of move around a little more, and that definitely caught up with me. So I've definitely taken a step back in that regards. Sitting up is still challenging for long periods. I can go maybe 20 to 30 minutes at a time sitting upright in a chair vertically. Most of the time I stay reclined in a recliner or laying back as much as I can to keep the wound open, and to also keep from that whole area from pinching, because it can still be painful. The standing is also okay. It's just that standing for long periods of time, as I've discovered, also can be a challenge. It's amazing how fast your muscles atrophy in your core when you're not using them. And for 3 weeks, I've not been using my core muscles very much. And so we recently had an anniversary dinner for my parents. Happy 50th anniversary, Mom and Dad. And that evening I was having to sit at a table a lot. And so I was getting up to stretch and move around the room so that I wasn't sitting for long periods. But as I moved around the room, I found that the muscles around my rib cage, in my abdomen, in my back really became fatigued more than painful, and I just became so tired that I had to go lay down. So but the progress is continuing. Every day, every hour is a little better, a little less pain, a little more movement, a little less fatigue. This week I was able to start back at work on strict desk duty, and so I've been back in the workplace. It was really nice to get out of the house, because I really hadn't been out of the house. Hadn't put on pants very often in the last 3 weeks. So it was really nice to get out of the house and get back to work. It's funny how you start to miss work. I got tired of streaming shows and being stuck on my couch. So that was very nice. Coming home, doing a lot of resting. And one of the concerns with my wound that came up in the 2nd and 3rd week was something called slewing. That is part of the healing process, but if it is not managed and cleaned out, we're using a solution called Vache. If it's not cleaned out, it can lead to an infection in the wound. So it's something that we're monitoring closely. We've got a lot of friends in the medical community who've checked out. My wife has taken pictures of my incision and texted it to people. We got a lot of really good advice, really helpful advice from our friends and family in the healthcare profession, checking out what is going on. Everything seems to be healing well, and so I'm just looking forward to getting back to all of my normal activities. After at week 6, it'll be August 1st, and that's when I can lose the 5-pound restriction and the stairs and things like that, and start to become more active. Any exercise is limited just to walking, and I'm very careful with walking right now. Still pretty ginger, still moving pretty slowly, but every day a little bit better, a little bit faster, a little bit stronger. So I'm going to keep on that journey.